My name is Stephen Hess. I'm Chief Performance Officer, Panorama Orthopedics Spine. Love this gig. Also operating manager for the Institute. About 12 years ago, I ruptured the distal attachment of the short head of my bicep. When it was reattached, there's necrosis in there. They had to attach it really tight. So what that does is it creates a dysfunction slightly in the shoulder. And over a period of time, I'd compensate, feel slight impingement, and I just keep going through. I did a contest in November. About 6 weeks after the contest, I felt amazing. I'm just warming up. I'm in a safe position, and it just went. My shoulder just went.
When Steve injured his shoulder, it was a massive injury, really one of the worst rotator cuff injuries I've ever seen. I got a phone call from him that weekend, and I said, well, let's look at the MRI. And then when I looked at his MRI, I realized, okay, this is truly awful. This is going to be good and challenging to treat. And of course, I've over the years treated thousands of shoulders, but his was uniquely bad. He didn't just tear the tendons away from the humeral head. They were in a very complex fashion torn away and retracted and pulled away. And so when you're looking at this MRI, instead of seeing the tendon coming over, it's pulled back and it's multi-layered, where the tendon itself was thinned and pulled back away from the humeral head. Took a lot of very precise work to try and get the tendons pulled back. So we ended up using every last technique that there is to get this complex tear fixed and to get all the tendons back to the bone. Came together beautifully and we got great coverage.
He had to go in, pull it out, reattach it. He put in anchors, he reinforced it with the gauze, added PRP, did the infraspinatus and the subscapularis. Out of every single surgery I've ever had in my life, the experience at Ortho Colorado, from Jude, the CEO, coming in, seeing how you're doing, to the massage, to the pre-op, to the explanation, it was the most, to the room, every aspect of it, I'm like, are you freaking kidding? To the cookies afterwards, and I don't even eat cookies, is without a doubt the most unbelievable experience I've ever had, having had a surgical procedure. The pain I've experienced through this surgery is way less than any surgical procedure I've ever had before. And I think it's the level of how much anesthetic they administered was right on.
We're very spoiled to have the best anesthesiologist in the state. They're incredibly well trained. They've all done fellowships. They're the best at doing regional anesthesia. So that means when you have shoulder surgery, you have this specialized ultrasound guided injection that's very, very precise.
The pain block wore off exactly how they said it would wear off. The modification of what you would utilize as pain medication and then ended. The procedures, the protocols, exactly what they said happened. But again, because I've experienced some of this before, to have very little pain after 2.5 weeks, and by week 3, almost none. I'm telling you right now, I'm at 5.5 weeks. I don't have pain in that shoulder. And these were massive tears.
Step 1 complete, massive tear. Now it's up to me. What I do and how I turn this around, 100% up to me. Let's go.
The other brilliant thing about Panorama, they're all specialized. So someone who does 40,000 shoulders, I want them doing my shoulder. Someone who does 40,000 knees, do my knees. Someone who does joint replacement, done 25,000. Those are the guys I want. We got them.
Yeah, 5 never felt so good, son.
And the thing that excites me about this group and where I'm at, they're never satisfied. If you're continuously looking to find a better way, you're always improving. I don't even highly recommend this place. This is the only place I would go.